Assalamu alaikum. I hope everyone is doing well. So today we are going to discuss about achalasia. So what basically is achalasia? Okay, so I'll make an esophagus over here. Okay, so this is going to be the upper part. This is going to be the middle part. This is going to be the lower part. So there is a sphincter over here, which opens, which relaxes, and which contracts on the entry of food. So whenever there is failure of relaxation, which means that it does not relax at all, the lower esophageal sphincter, due to the degeneration of the ganglia, loss of ganglia from the orbex plexus, this lower esophageal sphincter is not going to relax. So that is why the upper area would be dilated, esophagus above will be dilated as it is shown in this diagram. See, this is dilated. So whenever it is dilated because of the lower esophageal sphincter, then it is known as achalasia. So how the patient is going to present to you. So there would be dysphagia of both liquids and solids, but more of solids than liquids, eventually both. And what basically is dysphagia, which is that the person is going to feel like that he or she cannot eat anything. There is going to be obstruction sort of feeling in the esophagus. Then there is heartburn. There's going to be vague chest discomfort, regurgitation of food. So whenever the person is going, especially at night, so whenever the person is sleeping, so because the lower esophageal sphincter is not going to relax, so there is going to be a lot of food in the esophagus. So whenever the person is going to sleep, then and he's lying down, so there is going to be nocturnal cough or aspiration pneumonia can occur. So there can, okay, and it has been seen that in some patients, achalasia, there in the patients of achalasia, malignant change in small number of people is also seen. Okay. As I have started this uh, this line. Okay, so a long standing history of dysphagia to both liquids and solids is suggestive of functional dysphagia. So there are like two types of dysphagia. One is functional and one is mechanical. So whenever the person is going to have initially, there is a long standing history of dysphagia to liquids and solids, like long standing, then it is functional dysphagia. Otherwise it is going to be mechanical, which can be achalasia or any other disease of the esophagus. So always remember, it is a very very important MCQ. Okay, so next, so what basically investigations you can do. So the gold standard is esophageal manometry, and in which they are going to pass a endoscope scope, and they are going to see the esophagus. And esophageal manometry is going to be the one where they will be seeing uncoordinated or absent peristalsis. Okay, and then they can also give them the barium swallow, in which the initial picture that we saw, there is going to be a bird beak appearance. The upper esophagus will be dilated, the lower would be contracted, and there is going to be a bird beak appearance. And on chest x-ray, the mediastinum would be wide, and fluid level would be seen. Okay, so what treatment is there? So Heller cardiomyotomy is going to be the gold standard. Then balloon dilation, intrasphincteric injection of botulinum toxin, and drug therapy, nifedipine or nitrates, but it is under research that it might help in relaxing the lower esophageal sphincter, but its role is very limited. So what basically is a gold standard treatment? That is Heller cardiomyotomy. Always remember this. What is the investigation gold standard? That is esophageal manometry. Okay, what is Heller myotomy? So there it is. These are the laparoscopic camera and instrument ports. then see here a cut is created. So this cut is created, and what they have done is that obviously it couldn't be this lower part couldn't be relaxed. So what they did is that there is fundus, they moved this fundus and attached over here so that it acts as a sphincter. This is known as Heller-Markman, in which there is fundoplication, basically. Thank you so much for hearing me. So I hope you have learned this. So if you have, do subscribe my channel, and thank you so much. Allah Hafiz.